How to masturbate safely after 60. Essential tips for men's health. All right, let's have an open and honest conversation about men's sexual health after 60. I'm Dr. James Edward Carter, and I'm a board-certified urologist and sexologist with over 25 years of hands-on experience in men's health. I believe discussing this topic openly not only boosts your confidence, but also supports your overall well-being. Today, we're focusing on masturbation, not as something to shy away from, but as a natural, healthy part of life. In my years of practice, I've met countless men in this age group who stay silent about sexual matters due to embarrassment or lack of information. The truth is, masturbation after 60 can bring significant benefits, like improving blood flow, reducing stress, and maintaining sexual function. However, your body has changed, and it requires a smarter, more mindful approach. In this guide, I'll share a practical, science-based roadmap to help you care for yourself safely and effectively. We'll break this down into 3 key parts: the core principles for safe and enjoyable masturbation, common mistakes to avoid to prevent physical or emotional harm, and finally, critical warning signs you should never ignore, as they might point to more serious health issues. I'll explain everything in a simple, relatable way, with real-life examples from my clinical experience. Please note, this is educational information, not a substitute for personalized medical advice. If you have concerns, reach out to your doctor. Let's start with part 1. The core principles for safe masturbation after 60. Your body now is like a car that's been through many terrains. Still strong, but it needs careful maintenance. Principle 1. Listen to your body with patience. After 60, erections may take longer, be less firm, or need more direct stimulation due to lower testosterone, changes in blood flow, and reduced nerve sensitivity. This is completely normal, not a sign of weakness. Instead of forcing things like you might have in your youth, relax and explore. For example, a patient of mine once shared his frustration about not being as quick as he used to be. I suggested trying gentler stimulation, like slow strokes, and he discovered new enjoyment without pressure. Stress is a known erection killer because it spikes cortisol. Think of this as a chance to connect with your body more deeply. Principle 2. Lubrication is non-negotiable, not optional. The skin in your genital area is thinner and drier with age, producing fewer natural oils due to hormonal shifts. Without lube, friction can cause chafing, soreness, or even infections. I always recommend a high-quality water-based lubricant, free of fragrances or additives. Use it generously. Don't skimp. I once treated a gentleman with penile skin irritation simply because he used soap as a substitute. Invest in a good product. It makes everything more comfortable and safer. Principle 3. Create a private, relaxed sanctuary. Don't rush like it's a race. Worrying about interruptions or trying to finish fast keeps your body in a stress mode, blocking the parasympathetic response needed for arousal. Choose a quiet time. Maybe in the evening when you're alone, dim the lights or play soft music if that helps. This isn't just fun, it's self-care, like yoga for your sexual health. Many of my patients report feeling more confident and vibrant when they prioritize this space. Principle 4. Focus on the journey, not just the destination. Many men are conditioned to see orgasm as the only goal, but after 60, that pressure can backfire. Enjoy the process of stimulation, exploring different touches, light, firm, fast, slow. This keeps blood flowing to the area, maintaining healthy blood vessels and nerves. Medical research shows regular sexual activity, including masturbation, can lower the risk of erectile dysfunction and support prostate health. Think of it like gentle exercise. You don't need to break records, just stay flexible. Principle 5. Engage your most powerful sex organ, your brain. Sexual response is as much mental as physical. If you're anxious about performance, carrying outdated shame, or stressed from life, your body will follow suit. Practice mindfulness. Focus on the present sensations, breathe deeply, and accept your body as it is. I often suggest patients recall positive memories or use uplifting imagination. The result? Not only better sexual experiences, but also less depression and more confidence. A recent study from the American Urological Association found that men who maintain positive sexual activity after 60 report a higher quality of life. Now, let's move to part 2. Common mistakes to avoid. These errors can lead to physical or emotional issues, but the good news is they're fixable. Mistake 1. The death grip over time. Some men develop a very tight, specific grip that trains the penis to respond only to intense pressure. This can cause delayed ejaculation or make partnered sex less satisfying. The fix? Vary your grip, use a lighter touch, and rely on lube to retrain your nerves for a wider range of sensations. I've seen patients improve in just weeks with consistent effort. Mistake 2. Ignoring basic hygiene. Dirty hands or an unclean penis can introduce bacteria, leading to urinary tract infections or balanitis, inflammation of the glands. Always wash your hands and genital area before and after. It's a simple rule that prevents so much trouble. I've treated hundreds of cases caused by this oversight. Mistake 3. Forcing an erection. If an erection isn't happening, don't aggressively bend or stimulate the penis. A semi-erect penis is more prone to injury, which can lead to Peyronie's disease, a condition where scar tissue causes painful curvature. Stop, relax, and try again. Later. Health always comes before momentary pleasure. Mistake 4. Using unsafe objects or lubricants. Never use household items like bottles or soap. They can break, have sharp edges, or cause irritation. Stick to purpose-made sex toys and water-based lube. I once had to perform surgery on a patient who used an unsafe object, so please be cautious. Mistake 5. Viewing masturbation through shame. This is the most damaging mistake. Shame leads to avoidance, rushing, or skipping safety steps. Recognize that this is a healthy, medically supported act. Shifting this mindset will help you enjoy and benefit more. Finally, part 3. Red flags that mean you need to see a doctor. These aren't meant to scare you, but to empower you to act. Red flag 1. Persistent pain. Not minor irritation, but significant pain during arousal, ejaculation, or a deep ache in the penis, testicles, or perineum. This could signal infection, inflammation, or Peyronie's. See a doctor. Red flag 2. Blood in semen or urine. Hematospermia or hematuria. It's often minor, but it needs evaluation to rule out serious conditions like cancer. Don't panic, but don't delay booking an appointment. Red flag 3. Major changes in erections, like sudden inability to get hard or a new, painful curve. This could indicate cardiovascular issues or Peyronie's. Checking heart health is key, as erectile dysfunction is often an early sign of vascular problems. Red flag 4. New lumps, bumps, or sores. Do monthly self-exams. Feel your testicles for hard lumps and check for non-healing sores on the penis or scrotum. Most are benign, but they could be sexually transmitted infections or, rarely, cancer. A doctor should evaluate any changes. Red flag 5. A sudden, unexplained drop in libido. A gradual decline is normal, but a sharp drop could point to low testosterone, thyroid issues, depression, or medication side effects. These are often highly treatable. In summary, sexual health after 60 is an ongoing journey that requires listening, patience, and action. By following these principles, avoiding mistakes, and watching for warning signs, you're investing in your wellness and self-respect. Sexuality doesn't have an expiration date. It evolves, and you're in charge. Age 60 is not the end. take action to keep your sexual vitality alive. If you find this video helpful, like, share, and subscribe to the Vital Men 60 channel to get more reproductive health advice. Thank you for watching. You're not alone. Let's build strong futures together.